Okay, slice 2 of hemostasis. So, I suppose a lot of what we're going to be thinking about here is what exactly hemostasis is doing. Now, as we talked about in slice 1, the whole point of this is to try and maintain blood flowing normally. So, under normal conditions, hemostasis' job is maintains normal blood flow. So, what happens if something's not normal? Okay, so the next thing we got is what happens if we have trauma. Now, the whole point here is that we're trying to keep blood flowing around our body. Why? Well, blood flows because we need to take oxygen to where it needs to be, nutrients to where they need to go, to take waste products and take them away to where they need to go. Yeah? We've got a cardiac output of approximately 5 litres for a man and about 4 litres for a woman. If we have trauma and it's bad, we're going to lose this and then we die, okay, in extreme circumstances. But the point is that we need to keep our blood inside our vasculature where it's supposed to be. So, under trauma, we change. We then, rather than trying to maintain flow, we stop blood loss. And how do we do that? We form a clot. Then, after the clot has done its job, we go into wound healing. And then we come to the final job of hemostasis, which is after trauma. So, after healing, the next job then is to clean up. So, remove the clot and restore normal flow. Now, I suppose this would be as good a time as any, really, to kind of to introduce you to how this all functions. Now, when we teach this, we always teach it in 3 distinct phases. So, phase 1 is we've got primary hemostasis. Primary hemostasis. Stage 2 is secondary hemostasis. And then stage 3 we either call it stage 3 we call either tertiary hemostasis, but usually and more commonly it is called fibrinolysis. Fibrinolysis. Or sometimes you might hear it as fibrinolysis. Either is fine, and I will probably end up using both terms simultaneously. So this is this nice little bit of overview. Our next job is to start to do a bit of a deeper dive into primary hemostasis, and we'll do that in slice 3.